Oh, by the way,
Adam, is it on?
lives here in London. In charge of our mobilizations, and that is in the person of Dr. Amobi, and we're from Denver, Colorado. And next is also from United States, he's a cardiologist, and one of our chief investment director, Dr. Adc London. And next is also here in London, Dr. Richard Stephen is our actually country director, is our chief boss here. And also coming from United States is another person who is also in charge of our affairs in US. Hence is our country director by name, Pastor Emmanuel Oba. And then our director of our finance and audit already talked about himself, and no other person than Mr. John Owaike from Switzerland. And we have a country director in Switzerland, and by name of Mr. Honorable Bruno Obin. And as they come in, we got a couple more of them who made this thing happen. And with that being said, these are people that making this event happen today. I'm optimistic that it will be fun.
Thank you, sir. Thank you, Dr. Kafo. I really want to say, as you may know, this event is being put up in collaboration with Focus Africa. But we do not, for unforeseen circumstances, we do not have the Ambassador Success, who is the CEO of Focus Africa, who is supposed to speak to you. Therefore, we are going to skip that. Right now, I want to call on the stage someone who was already introduced, but for him to come and say welcome to everyone here. And I'm talking of no other person but Dr. Richard Stevens, who is the country director here in the UK. Dr. Richards. Welcome, sir.
Thank you so much. Good afternoon, ladies and gentlemen. It's a privilege to be here, and I appreciate you all being here. My name is Dr. Stephen Richard. I'm the country director for ADC and NDFI. I stand all existing protocols, and just to let you know that about a year ago, some like-minded guys came together to get this movement on in order to reverse what has been wrongly put in place, brain drain of Africans. We want to take it back to Africa. And this is the first conference we are putting together, and I know you will enjoy it. Just relax and have a great time. Once again, you are welcome. God bless you.
Thanks a lot, Dr. Richards. At this point, we are going to set this ball rolling by inviting to the podium once again the chairman of ADC for his address to the audience. Dr. Kafo, please come up to the podium.
Thank you again. Your Excellencies and distinguished delegates, on behalf of the African Diaspora Corporation and the Nigerian Diaspora Forum International, otherwise known as NDFI. I welcome you all to this our 2024 London Conference titled Focus Africa Forum on Leadership, Cultural Advancement and Investment in Africa. This two-day conference aims to refocus and showcase Africa to the world. It will seek ways to reverse the long-standing African brain drains to brain gains in human capital development by driving diaspora engagement and investment into the continent. We will have a robust discussion on the key drivers in this paradigm shift, like leadership, government policies, economy, security, etc., and profile strategies and the way forward. These discussions on the new strategies could have not come any better time than now, when massive economic downturn is sweeping the African continent. Many investors has left due to lack of enabling environment to do business in the continent. It is therefore time for Africa to turn to the diaspora way, as many Asian countries like India, Philippines, and Malaysia did. The African diaspora constitutes many leading scientists, engineers, healthcare professionals, economists, computer analysts, innovators, and etc. in the Western world. Their immense contributions to the advanced development of these countries today served as a beacon of hope for Africa. It is time for African leaders to harness and tap into this knowledge and the economic wealth of their citizens living outside the shores of the continent to rebuild a new Africa as emerging economy. We encourage you to partner with African Diaspora Corporation as we drive and mobilize diaspora engagement on the continent. We hope you enjoy the discussions, the lunch, and the entertainment that are lined up today. Thank you for attending, and we wish you a safe home to your various destinations at the end of this conference. God bless Africa. Thank you.
Thank you so much, Chairman. What a great introduction to why we are here today. And thankfully, there are many of you here, many African leaders here today, and more to come. I understand there's a bit of traffic due to the unpredictable weather of the UK. So there are more people on their way. But it's good to know we have the right people in the room to do just as Dr. Okafor said. They're the right people in the room. So please, let's connect, let's network, and find out how we can collaborate to further this agenda. So without further ado, I would like to introduce our first keynote speaker. We have Dr. Aminu Hamidu Mohammed, the Managing Director of Venus Medicare in Nigeria. Dr. Mohammed has been at the forefront of healthcare in Africa, championing initiatives to improve health insurance and access to affordable healthcare across the continent. His keynote today will focus on diaspora health insurance in Africa. Please join me in welcoming Dr. Aminu Hamidu Mohammed. Thank you. We can keep tapping. Today, we're going to use a lot of energy. Can we welcome him, please? Thank you, sir. That was a long walk, wasn't it? Awesome.
Good afternoon, ladies and gentlemen. Thank you very much for the opportunity. My name is Dr. Chidi Ubogulu. Dr. Minu, who is extremely passionate about promoting healthcare in Nigeria, sees this forum as where he would have wanted to be. You know, unfortunately, logistics failed him. You know, I think his visa was delayed, so he couldn't come in. So I'm based here in the UK, so I'm representing him. I was the former COO of Venus Medicare while I was in Nigeria, and we're still doing a lot of collaborations and providing guidance and all that. So I'll just go through what he has asked me to deliver to you. So distinguished guests, ladies and gentlemen, it's a great honor and privilege to be here with you today at this important gathering of Nigerians in diaspora. I want to extend my heartfelt appreciation to the organizers of this gathering on Focus Africa on leadership, Focus Africa Forum on leadership, cultural advancement and investment opportunities in Nigeria, and for inviting me to speak on a matter that is close to all of our hearts, the health and well-being of our loved ones back home. What more can be in line with advancements and investments than the healthcare component of human capacity development? As we gather today, we're united by a shared love for our homeland, Nigeria, and a commitment to the welfare of families and communities. Living far away from home, as we all know, we've all faced countless challenges and made numerous sacrifices. You continue to play an invaluable role in supporting the social economic development of our country, not only through professional achievements, but also through generous remittances that support millions of families. So what is the Nigerian disease burden? It's important that we talk about this. Nigeria, as we all know, faces a significant disease burden. According to WHO, Nigeria accounts for 25% of malaria cases globally. Furthermore, non-communicable diseases like hypertension, diabetes, and cancer on the rise, accounting for more than 29% of total deaths in Nigeria. In addition, the recent pandemic has exposed the vulnerabilities in our healthcare system, placing even more strain on our resources and capabilities. These statistics highlight the urgent need for a robust healthcare system, capable of providing timely and quality care to our citizens. Yet, despite these challenges, access to healthcare remains limited for many Nigerians, especially those in rural and undeserved areas. Healthcare financing is also a challenge. So in Nigeria, this presents peculiar challenges. A significant portion of healthcare expenditure is out of pocket, the OPP, making up 70% of healthcare expenditures, according to the National Health Accounts. This places a huge financial burden on families, often leading to catastrophic healthcare expenditures that push households into poverty. In a country where public health system is underfunded and overburdened, the role of private health insurance is critical. However, less than 5% of Nigerians, 5%, are currently covered by health insurance. The gap underscores the urgent need for innovative solutions to provide financial protection against healthcare costs. As I said, Nigeria faces a significant disease burden, from malaria to hypertension, diabetes, infectious disease. The healthcare system is continually under pressure, and the reality is that many Nigerians are faced considerably with healthcare challenges. And this becomes a sort of genuine worry to us who are overseas. The responsibility of ensuring that our families receive proper medical care can sometimes be overwhelming, especially when we are thousands of miles away. So the importance of timely access to healthcare is key. It's not a luxury, it's a necessity. For emergencies, the difference between life and death often comes down to how quickly a patient can receive medical attention. Unfortunately, many Nigerians do not have the luxury of immediate and affordable access to quality care. This is where you, our compatriots in diaspora, play a vital role. Your support can be the difference in ensuring that your loved ones receive timely medical care. There's also the challenge of proxy caregivers and overbloated medical expenditures. Of course, we are aware, proxy in terms of people you have to rely on to help your loved ones back home. And sometimes the facilities can be dubious in terms of costing. So many of us have experienced or heard of situations where funds sent back home for healthcare are mismanaged, and are given away through inflated medical bills. Your absence is being, taken for granted, advantage. So these challenges often lead to overbloated medical expenses, leaving you with financial burden and emotional strain of wondering if your support is truly utilized for the intended purpose. There's also the inability to access the quality of care that your loved ones receive back home. Not being physically present makes it challenging to monitor the healthcare services that your loved ones receive. You want to ensure that you're treated with dignity, respect, and professionalism. But how can you be sure? This uncertainty causes sleepless nights, anxiety, and a feeling of helplessness. Thank God for diaspora remittances. It's a lifeline for the healthcare industry in Nigeria. Ladies and gentlemen, your contributions through remittances play a vital role in the economic stability of Nigeria. According to the CBN, Nigerians and diaspora remitted over $20 billion annually in recent years, with a significant portion of this amount allocated to healthcare. In the past 3 years alone, it's estimated that around $3 billion have been remitted specifically for healthcare purposes, and this demonstrates your unwavering commitment to ensure the health and well-being of your families back home. However, despite these huge remittances, many of you have faced challenges in ensuring that funds sent are used effectively and efficiently. The issues of dubious proxy caregivers, unverified healthcare providers, overbloated medical expenses, and the inability to ascertain the quality of care have become common concerns. So these challenges often result in a lack of trust, transparency, leaving you, the diaspora relatives, to bear the burden of uncertainty and financial strain. And this is where the trusted solution comes in. Venus Medicare, partnering with the organization. It is precisely these challenges that Venus Medicare seeks to address. We're more than just a health maintenance organization. We are trusted partners in ensuring the health and well-being of your loved ones are taken care of. By partnering with Venus Medicare, you can be assured that the financial burden of healthcare will not solely rest on your shoulders. We have offered comprehensive health insurance plans that provide access to a wide network of quality hospitals and healthcare providers across Nigeria. As a leading HMO in Nigeria, our mission is to provide comprehensive, affordable, quality healthcare service to Nigerians. And we understand the unique challenges you face, and we're committed to being trusted partners in healthcare. What are the benefits of partnering with Venus Medicare? Venus Medicare has a huge range of customized healthcare plans that suits your needs and the needs of your loved ones back home. there's financial protection, and there's security. There's also timely access to quality care through the extensive partnership with a wide range of hospitals. I think the network is over 600 centers nationwide, and a dedicated team of extremely qualified medical personnel to monitor the level of service and ensure that there's good quality care. Venus Medicare is also transparent and accountable. Of course, we know that with insurance, a lot of times, sometimes you could part with premiums and then you don't have good quality service. People are not able to pay bills on your behalf. But over the years, the company has done well in that area. And there's also peace of mind that the company gives you and your loved ones for that partnership. Ladies and gentlemen, as Nigerians in diaspora, you have the power to make a significant difference in the lives of your loved ones back home. By partnering with Venus Medicare, you're not just buying health insurance, you're investing in health, safety, and well-being of those who matter to you most. Let us work together to lift the healthcare burden from your shoulders and place it in the hands of professionals who care. I urge you to consider the immense value that Venus Medicare can bring to your lives and the lives of your loved ones back home. Let us work together to lift the healthcare burden from your shoulders and place it in the hands of professionals that care. Together we can ensure that the healthcare challenges facing our country are met with solutions that bring hope, healing, and a better future for all. It's important to note that there's been a lot of collaboration with the Nigerian team of Diaspora Forum with Venus Medicare. I think lots of health plans have been already tailored. So it's just for you to have a look at it and key in so that the financial burden can be much taken care of. Thank you very much, and God bless you.
Thank you so much, Dr. Chidi. We really appreciate it. One thing stick to my mind while he was speaking. Healthcare is not a luxury, it's a necessity. Who amongst us here from Africa have not had this experience where you send money for someone to go to the hospital? All you heard afterwards is, oh, we are trying to take care. There is this local medication that helps. And all of a sudden, your mother who just broke her leg now is having pain in her hips. Gradually, you are now hearing she can't walk again. What happens? This is when the cost starts. That thing that could have taken just $1 to cure is now a mounting problem. Now, thank you for aptly mentioning that. It is going to be something that we help you reduce costs. Because sometimes opportunity costs are even more than the real cost. And this is one thing that made us, as an organization, to start seeking how diasporans can come in. So partner with us, Diaspora Corporation, African Diaspora Corporation. And I want to highlight something. As Dr. Chidi was speaking, he talked more on Nigeria, but remember, this is for all Africans. Our aim and hope is that all African countries, because we share the same problem. So at this point, without taking much of your time, and thanks again for this wonderful speech, quite helpful to understand how you can. But remember, partnering with us, African Diaspora Forum, gives you a leverage. You can see that on our website. You can reach out to us at any time for us to solve this problem together. At this juncture, I want to invite the next speaker. We are talking about health insurance. Now I want to invite to the podium Dr. Terence Baker, a US physician. Dr. Terence Baker, oh yeah, please give it more. Thank you. You know, there's something I observed earlier. Dr. Baker was the first person who started clapping when we were introducing ourselves the first time. And so he deserved more claps. Thank you so much. Dr. Baker is a certified emergency and forensic medical physician from the United States. Dr. Baker is the CEO and president of Soli Medical Center in Baltimore, in Maryland. He has made significant contributions to healthcare, both in the United States and, of course, in Africa and around the world. He helped in establishing the Katani Hospital in Kenya. Today, Dr. Baker will be speaking on health insurance and access to affordable healthcare in Africa. Please, let's join hands and welcome Dr. Baker to the stage. Dr. Baker, please keep clapping. Keep clapping. Yes. Thank you so much. Please, Peter, from this side. Thank you so much, sir.
Thank you so much for being here today. I also want to recognize that all protocols, policies, and procedures are in place. All etiquettes are being observed. Today is a historical weekend, and for those of you who have made it, I know many of you faced obstacles for being here. And so you're to be congratulated for getting around the obstacles, because whatever you call our enemy, whether you call him the devil, Lucifer, just life, there's been a number of obstacles thrown in front of our colleagues who plan to be here and they're on their way but haven't made it yet. I personally had a 5-hour delay in my flight getting here. And so you are to be congratulated for getting through those obstacles, because the last thing the enemy wants is for us to be here today, because this is a new day, and I think it's a new day for all 54 nations of Africa, whether they're represented or not. We may talk a little bit about Nigeria and Kenya, but we're really talking about all 54 nations. Each of you are on assignment, whether you know it or not. I'm not here by accident, and neither are you. And so you're on assignment. You know, God has you here because this plan must succeed. As a physician, I am tired of hearing about 2,500 or more children in Nigeria will die this day while we're at this conference. Now think about it. I want you to wrap your hands around it. Don't just listen to the words, but wrap your mind around the number. 2,500 children between the ages of 0 and 5 will die today in Nigeria. All but for healthcare insurance, and all but for $8. On average, $8 American would save the life of most of those children. Just wrap your hands around that. The importance of this healthcare project for the diaspora, not only of Nigeria, but all of the nations, come together to embrace Venus and other partners to put together a healthcare insurance policy that will allow healthcare to be within an hour of every living, breathing African, regardless of the nation. Now, today we're going to spend a few minutes just talking about healthcare in Africa. And so we're going to be talking about access to healthcare in Africa next. Africa needs a voice on the world stage. When was the last time you heard the President of the United States, Joe Biden, or any other president, call up an African leader, an African president, and say, please come to the White House? Now, it's true that Mr. Ruto, president of Kenya, was invited to come to the White House recently to solve a crime problem in Haiti. And for that, he got a couple $2 billion. But other than that one event, can you think of any other time in recent history where an African leader was called to the White House, or Mr. Netanyahu in Israel, or the Prime Minister here in London, any other nation, to ask for your help? And yet, the answers to many of the world's problems lie within your hands, lie within the nations of Africa's hands. Listen to this. The answers, wrap your hands around it. Wrap your minds around this. The answers to many of the world's problems that we're facing today lie within your hands and the hands of the African nations. Contributions of the 54 nations of Africa to the world is enormous, yet there's a reluctance to give Africa a voice. Why is that? Next. The reason being is the world's youngest population lives in the continent of Africa. So that is a tremendous resource. Within 2 decades, Africans will make up 1/3 of the global workforce. Nigeria I've already told the leadership in Nigeria, and I lectured last fall to a group of pharmacists in Nigeria, foreign trained pharmacists who have returned to Nigeria, taught them about the fact that the world's workforce, the future of the world, lies within the African nations. And Nigeria is already doing a fantastic job. Nigeria and Kenya are already doing a fantastic job of supplying workers. In the United States, one of the fastest growing reserves of nurse practitioners and physicians are Nigerians. Very important. We'll talk about that in a minute. Most of the modern world exists only due to African national resources. 65% or more of all the resources necessary to move this world into the future lies within the continent of Africa, within the 54 nations. Precious metals, gold and silver, diamonds, precious stones, rare minerals that are necessary for electric cars, that are necessary for this Green New Deal that we've embraced on. And so the wealth and the resources necessary for the world to move forward lies within the 54 nations. Next. The world is reluctant, however, to embrace Africa as being serious. Now, why is that? Well, we've seen one reason here today is that we have a groundbreaking meeting occurring this weekend. But we've allowed ourselves to start late. And I got to tell you, I actually asked the chairman when he said, Dr. Baker, come down at noon today. I said, are we on Nigerian time or are we on London time? I did. He'll tell you. And the reason being is that Africa as a continent, and I'm not going to pick on any one nation, because African time tends to be a little different than the world's time. But I got to tell you, as a businessman, I'm 70 years old this year, just had a birthday, and I got to tell you that the world only wants to partner with people who show up on time. Whatever that agreed time is, you got to show up. And it's just like healthcare. If you need me to save your life, you need me to show up on time. Sure, because minutes count, and an hour later you could be dead. So what are some of the reasons that the world's been reluctant? And we're getting ready to change that one partnership at a time. Corrupt leadership. Okay, I've had discussion with many of you about the current leaders of your nations. And we are not doing a good job. We, the people, are not doing a good job of picking leaders. And it's not just here, it's the United States, it's everywhere. Next is poverty. Poverty, not knowing when you're going to eat, not having housing, not having any clean water, it just prevents the citizens of your nation from having any life and contributing with the future of your country. Starvation. How can you contribute to society if you're starving? Okay, failure to control common treatable disease. Food dependence, energy dependence, food emergencies. There are many partners who want to bring your nation, African nations, answers to your power shortages. I believe one of those answers are these new compact nuclear reactors. They're clean, they're easy to protect, they're durable, they're reliable, and the waste material is very limited. That's just my opinion as a physician looking at all the options. We have terror. You can't live in a nation and be productive if you have constantly being plagued by terror. And Nigeria right now is just out of control. You know my handlers, they won't even let me go out of Lagos. I'm scheduled to speak in Nigeria in 2 months in October before a group of pharmacists. And they won't let me out of their sight. And I used to walk the streets of Abuja, Lagos, Southwest Africa, wherever I wanted to go. I, Dr. Terry Baker, just walked the streets alone. And now I got to have a guy with some M16, some, gun to protect me, as if he could protect me. If they wanted me to just take me. No, I mean, really. Somebody said they were going to have me fly into Lagos and take a limo up to Abuja. I said, we won't make it. No, we won't make it. Why? Because if they want me, they'll take me. Why? For money or just the fun of it? Slavery. Limited clean water access. Do you know the number of people who are going to die today because they don't have a glass of clean water? Nowhere in Nigeria, there are places where they haven't seen a glass of clean water in a long time. Lack of housing, lack of education, inadequate human resources, inadequate budget, poor leadership, and fake medications. I'm going to be lecturing. You're welcome to come to the lecture in Lagos at the Sheraton Hotel in October. I'll be there speaking for a couple days on fake medications and how it's destroying your mothers, your fathers, your children. Next. The results. The failure to provide minimum access to health care. There's just a lack of access to affordable health care insurance. And that's why you're here today, because today you have a solution. You have a decision to make. You have a possible solution that will start the process of providing the minimum necessary insurance, the necessary minimum care. The figure that was put out was less than 5% of all Nigerians, 5%, less than 5% of all Nigerians have healthcare insurance. And over in Kenya, they have a national healthcare insurance program, but it's bankrupt. It's not paying my hospital any monies. Then NHIF, National Health Insurance Fund, is bankrupt. So nobody knows where the money went. It's just gone. Next. Trade, not aid. I don't want to see any more free care or free monies being given to Africa because it's never free. But I love to see trade. I love trade. I love business relationship, but not aid. And only through trade will the African continent understand its true position in the world. Next. Health is wealth. It's my opinion that when you have a healthy nation, you have a nation that is Thank you. That is positioned to move forward. The impact on the economy is immeasurable. Next. African nations with currently the best healthcare systems is Kenya, ranks 53 out of 195 according to the World Health Organization, and South Africa is 49 out of 195. Next. The concept of African healthcare is important, and the speaker before me from Venus talked about the benefits of partnering with a company like Venus Healthcare. Next. Challenges. Africa bears more than 24% of all the disease in the world. Only 3% of the healthcare workers, only 3% of the doctors and nurses that you need are available to Africans. And yet 24% of all of the disease process. Less than 1% of the world's financial resources, including health care insurance plans, exist in Africa. Next. Most common medical conditions, you heard about them earlier: malaria, diarrheal diseases, upper respiratory tract infection, HIV. Next. Strengthening healthcare infrastructure. You have a plan, and you're getting ready to enter into a relationship where, for the first time, a diaspora and a healthcare insurance company can come together to provide the infrastructure that you need to start. Not the end. This contract signing today is not the end of the relationship. It's the beginning. It's the first step, not the last step. It's one of 1,000 steps. Next. Challenges. You know the challenges. Lack of funds, lack of leadership, care infrastructure problems. But I was very happy to hear Venus today talk about the measures they've taken to ensure the success of this relationship, because each one of these was addressed by my colleague who presented the benefits of this relationship. Next. Strategies to address. We've already talked about those. The previous speaker did a good job of covering those. Next. And then finally, the benefits of a national healthcare insurance and the importance of having one or more partners. You may partner with more than Venus Medicare. You may have a series of partners that you partner with, because as you grow to all 54 nations, Venus may not be able to go to all 54 nations. But Venus is a start for Nigeria, and hopefully after that, Kenya, and hopefully after that, South Africa, and then the other 51 nations. So it's a starting point. It may not be your only partnership. It may not be your only relationship, but it's a start. Next. Yeah, and here we talked about the roles of the insurance task force. Venus has in place the infrastructure necessary to start the relationship. I think they can be a very valuable partner, and I encourage you to endorse this relationship because it's a starting point and it's a new day. It's a new day for the continent, all 54 nations. Next. The road forward. The road forward is to persist, because when each of you leave here, you're going to leave here with a dream. The dream of this relationship between the Diaspora and Venus Medicare. But there's going to be 1,000 obstacles that jump up. There's going to be 1,000 reasons why this relationship shouldn't continue. There's going to be 1,000 roadblocks and obstacles jump into place, just like it did for some of our colleagues who haven't made it here yet. So the road forward, you have a good intention, but you must persist. And one of the things that I've come to realize as a physician, there's sometimes in the care and treatment of the patient that I just need to stand. I just need to stand. And this organization, this team, this task force that's here today is going to need you to stand. When things are going well, you stand. When things aren't going so well, you stand. But I'm asking each one of you to make a commitment before you walk out those back doors today to stand regardless of how this project's moving forward. Pray frequently, as if it all depends on God to guide us. And then work like a dog to make sure the project gets done. And when you can't do anything else, just stand and support this project. Next. Thank you very much. That's a little bit about me. Sorry I ran over 2 minutes, but I felt the message was important. And so thank you for being here.
Thank you so much, Dr. Baker. Chiwa, you may come up stage, please. All right, thanks a lot. You see, we are aligning very well, huh? Okay, thank you so much for your wonderful speech. Of course, Chinwe will talk a little more about that. We know that I see the enthusiasm in your faces and people are energetic and agile. Nonetheless, we need to take a little time for comfort break. So please remember, there was this man who went to an event. He wanted to make a presentation. He was really curious. He wanted to share his ideas and knowledge, so he didn't want to wait. He was pressed. He said, let me finish, and then after I go. But at one point, he couldn't hold it. He just held up and said, you know what? At this juncture, I need to tell you that I need to get out here and get my slide. He refused that he was just presenting, you know? So remember, convenience is important. By the side here, we have the toilet and bathroom where you can go for the convenience. And downstairs, there is also, actually outside, no, ladies first. So the ladies, you have a toilet here where you can go ease yourself. Men, you have to walk a little more, okay? So after that, you have to walk down. You will see a sign by the side showing you exactly where you go for the necessary thing. Outside, we have coffee and a little bit of snacks. Make yourself comfortable. And this is an opportunity again to network, right? Network is everything. Why am I here? Network. Why are you here? Network. Where's my sister? Why did you come here? Network. If not, I wouldn't know you. Joy, why are you here? I got to know you through network. Should I mention more? Okay, let's have a comfort break. Thank you so much, and see you later. Clap for me. Clap.